program at the Federal Medical Center, Abeokuta, in Ogun State. Dr. Olugbemi's passion and drive stems from his innate desire to see that cardiac surgeries become routine procedures in Nigeria all across the country, both in public and private hospitals. He returned to Nigeria to join in the training and building up of the field of cardiac surgery in the country. Welcome, Doctor.
Thank you. Thank you very much.
Okay,
Nice
wow.
to be here.
Same.
Pleasure.
Lovely to have you.
Thank you.
You've absolutely done a lot in this field. And very intense resume. As always, you're welcome to be a part of the show. If you have any questions or any comments, you can of course send them to us via WhatsApp. The number is 0809 444 0981, or you can actually call in live. The number to call is 01 4489 981. Okay, Dr. Olugbemi, let's start with the basics. Back to basics.
Okay.
Right. So, you know, a lot of people have heard the term heart failure. Yeah. But what does it actually mean? Does it mean that the heart basically has stopped beating or it's stopped working?
Thank you very much. Yeah, heart failure, it doesn't mean that the heart has stopped working or stopped beating. No, it doesn't mean so. What it simply means, heart failure simply means that the heart is not performing optimally the way it should. You see, because the heart, the main function of the heart is to beat and circulate blood, push blood from the heart to all the organs of the body. Okay, right. So that is the main function of the heart. But when the heart is not able to meet this 100% need, then you say the heart is failing. And failure of the heart can be to different degrees. Okay, so heart failure doesn't mean the heart has stopped beating. No, it only means the heart is not functioning optimally. So there could be maybe a problem with the conduction with different parts of the heart. Okay, but it just means the heart is not performing 100%.
Right. Yeah. So if a person's heart is not beating, basically that means they are no longer with us.
No, I would not say that. As a cardiac surgeon,
okay,
I wouldn't say that. Because when operating a patient, we stop the heart from beating. And then we bypass the function of the heart and the lungs to a machine called the bypass machine or the heart-lung machine. And then the heart is still. And then you can operate on the heart, do what you need to do. And then when you're done, you return the functions of the heart back to the heart and the lungs, and then you start up the heart again.
Wow. Yeah. Seems very intense. Yeah. Yeah. I guess this is why you need the sort of training and experience you have to be able to do that. Yeah. Okay. Now, speaking about heart failure, is this something that is relatively common? And are there certain people who are more at risk? Maybe older people, you know, things like that?
Yes. Heart failure, like I said, there are different degrees of it. So it's quite common, but though in Nigeria we don't have exact data yet. Okay, but back in the US, there about 500,000 new cases they see every year. Okay, and it's more prevalent among the elderly ones, basically because the elderly ones have what we call comorbidities or other illnesses, okay, that opens them up to heart failure. Okay, and then it's also been noted that heart failure is more common in men than in women. So we have more men than in women, you know, but it's the severity, however, is more pronounced in the females than in the male, than in the men. Okay, so yes, in the elderly, they're more predisposed to it because of their age, number one, and because of other diseases or illnesses that they may be having as well.
Okay, you know, when you said it's more prevalent in males, I was going to say, yes, another reason to be grateful I'm a woman until you said the other part. Okay. So who, apart from the genders and,
Yes.
the age,
Yeah.
the age grade that you've spoken about, are there any other groups of people that are more likely to be susceptible?
Yes. Um, Patients that are hypertensive. Okay. Patients whose blood pressure are high. They have high blood pressures.
Mm.
Patients that are diabetic. Okay. Patients with very high blood sugar. Okay. They are diabetic patients. They can have complications, and these complications can rebound on the heart. Okay, and cause heart failure. Same thing with patients that have kidney problems, renal problems.
Mm.
So you see, heart failure itself, it's many times as a result of other diseases. Okay, so it's like an end point. Okay, and then people that are obese. Okay, obese people that are big, on the
Mm.
big side, it puts a lot of pressure on the heart. So there are so many other conditions. People that smoke, okay, people that take alcohol. All these are predisposing factors,
Okay.
to heart failure. Yeah,
All right.
yeah.
Now, I'm curious about this. So, what actually causes heart failure?
Yes, heart failure can be caused by many things. First, there is a group of what we call idiopathic. That is, you can't really pin what is causing it. Okay, you
Mm.
can't really explain it, but it's just there. We call it idiopathic cardiomyopathy. That occurs. You don't know exactly what is causing it. Okay, you have a group of people like that.
Mm.
But more commonly, you have other causes. You see, the heart is divided into two main parts. You have the structural part, that is the heart, the physical heart you see,
Mm.
and then you have the electrical part. You see, the heart beats a particular number of times per minute.
Mm.
The ability to do that is embedded in what you call like an electrical circuit in the heart. So the heart has two parts: structural part, the electrical part. Any problem with these two parts can lead to heart failure. For instance, a patient that has problem, say the heart has valves,
Mm.
has about four valves. If there is a problem with these valves, the valve is supposed to maintain a one-way traffic. But when there's a problem with the valve, it becomes two-way, and that becomes a burden on the heart. Okay, so the heart can begin to fail from there. Now, patients that have hypertension, for instance, with long-standing hypertension, what happens? The muscle begins to build up. Okay, the heart tries to compensate for it. Trying to, keep things still going. But
Mm.
after some time, the chambers begin to dilate. So when that begins to happen, the heart begins to fail. So it could be problem with the valve, problem with the chambers, problem with, there is a thin film of tissue, we call it a pericardium. It's tough, okay, but it surrounds the heart. Okay, it keeps the heart, and in there's some fluid before you now have the heart. That pericardium can also be diseased, and if it is diseased,
Mm.
then there can also be failure. Apart from that, infection of the heart itself, okay, endocarditis, what we call infective endocarditis, it can also happen when just like infection that you have in other parts of the body can happen to the heart. And when that happens, then the heart can also fail. Now, going back to the electrical parts,
Mm.
now before we go to the electrical part, the heart muscle is also supplied by blood vessels. Just like the heart pumps blood to every part of the body,
Right.
it also pumps blood to itself. Actually, the first branches
Mm.
that comes out from the aorta, from the heart, goes first to the heart.
Okay.
Now, those branches, those blood vessels can get narrowed. And when they get narrowed, there can be a problem because the heart will not having enough food.
Mm.
Okay, so that can also cause heart failure. Then for the electrical parts, there can be a problem with conduction. If you see that your pulse beats a particular number of times every minute, it is constant.
Mm.
But if there's a problem with that balance, then the heart can also fail. What we call complete heart block, in which case the one side of the heart is doing something different from the other side. It's supposed to be a rhythm, okay?
Right.
But if one side is doing something different from the other side,
Mm.
then everybody's just doing their own thing. It's not coordinated.
Mm.
So we call that complete heart block. So that can cause failure. Or if, for instance, instead of your heart beating 60 times,
Mm.
it now beats like 40 times. So the number of times is reduced. So the blood, the heart will need more pressure, more force to push more blood,
Mm.
to the heart. So those are things that causes heart failure.
All
Really,
right. So just curious, how many times is a healthy heart supposed to beat per minute?
averagely about 72, but anything between 60 and 90 is fine.
Okay.
Yeah.
All right. And you hear of people who are trying to, trace their ancestry because there's always a worry about health conditions that are hereditary. Is heart failure one of these?
Um, I will not say in a strict sense, but some diseases that predisposes to heart failure, like hypertension,
Mm.
diabetes, these can be they are kind of hereditary. So it can be passed on to generations. So that in that light, you
Mm.
can say yes. Okay, you can say yes in that light. And there are some other conditions, but these are the two prominent ones. If in fact in some family, you see they are big in the family, they are
Mm.
big, they are fat. So those are things that can be passed on indirectly, affecting causing heart failure.
Okay.
Yeah.
Well, if you have a question for the doctor or a comment, you can, of course, give us a ring. The telephone number to call is 01448991, or you can send us a message via WhatsApp 0809 4440981 and ask your questions or share your comments as well. But we're taking a quick break, and when we return, we'll continue speaking with Dr. Olubemi and take more of your messages and phone calls as well. This is Smooth Health on the Drive.
Health on the Drive. Smooth Health is powered by
Okay, so we're
Evercare
taking
Hospital,
a
Lekki,
quick break.
transforming healthcare in
Sir,
Nigeria.
please, let me move this way a bit. Yes, like a bit more. Yes, so that they can see your face. So we can see your face. Don't worry, you can face straight. Just
Okay. All right, I think we're good to go. It's Smooth Health on the Drive right here on Smooth 98.1. I'm Zibby, and our special guest this lovely Thursday is Dr. Augustine Olubemi. He is a cardiovascular and thoracic surgeon. We're speaking about keeping your heart beating, understanding early signs, symptoms, and treatment options as well. Let us know what your thoughts are. If you have any questions, this is the time to send them in. 01448991. That's the number to call, or you could just send those messages to us via WhatsApp 0809 4440981. So earlier, doctor, before we went on the break, we spoke about heart failure,
Yeah.
who could be suffering or who is more susceptible to heart failure, yes, and possible causes. So now let's talk about the signs and symptoms.
Yeah.
What should someone look out for?
Okay. When you talk about signs and symptoms simply means what the person is feeling.
Mm.
Okay. The signs are what the doctors look for in this person. Okay. So I'm just going to dwell more on the signs. Okay. I mean on the symptoms.
Okay.
So depending on the degree of heart failure, the patient can have first thing difficulty in breathing. Okay. Easy fatigability, that is, they get tired easily. They do a little work, they are tired. Many times these people, they tell you that before I used to climb up to 5 flights of staircase without stopping, but now I climb 3, I'm tired, I have to stop. Easy fatigability, that is one sign. Cough. Some of them are not able to lie down flat. Yes. Many times you discover that they will tell you that sometime last year I was using 1 pillow, now I use 3 pillows to sleep, because they have to be propped up in order to sleep properly. Okay, so those are some of the signs. Sometimes As those are some of the symptoms. Sometimes their legs are swollen.
Mm.
Their legs are swollen. It doesn't mean that they stepped on a poison or something. No. Okay. It could just be heart failure.
Right.
Okay. And then sometimes it's the abdomen that is swollen. All right. So these are the common signs. Some of them get tired easily. They are weak. Some they lose appetite. There is this malay. They get. They're just disconnected. So they look chronically ill, especially the ones that have advanced. That no, something is wrong with this person. And funny enough, some of them actually seem to put on weight. Well, I would say an artificial weight, because the fluid that is supposed to coming out of the body is accumulating in the body. Yes. So you see their legs are swollen, their abdomen is swollen, they are coughing. So those are the symptoms that these people usually will present with. But the most important one, or the earliest one, is they get tired easily. So if you find out that you're getting tired too easily, there just may be a problem with the heart.
So is it possible that someone could actually have the symptoms of heart failure and still have a regular life?
Yes, yes. I say so because heart failure, there are 4 grades, okay? 4 classification. So it depends on what grade it is and what is causing the heart failure. Okay. Sometimes some people have the heart failure and they are taking their drugs very well. So they are being maintained on their medication. Okay, so yes, life goes on. Okay, but if you don't take your medication, then the complications begin to set in.
All right. We have a phone call coming through. Okay, well, give us a ring back. You know the number 0144898981. But there's a message here, and this is from Bolahan, and he says, "Hello, Dr. Olugbemi. I know you've made a lot of emphasis on obese people and people who live a sedentary lifestyle. Could you shed some light on why fit and athletic people still suffer from heart failure and cardiac arrest, like footballers suffering an attack on the field?" And he says, "P.S. I'm training for a marathon, so I need to know the signs to look out for. Thank you."
Okay, again, it's important to note that there are different causes of heart failure. Okay, so obesity or being big is not just the reason. There are so many people that are big and obese, but they are not in heart failure. Okay, but it's just a predisposition to it. So that you're big doesn't mean you're going to have it. Okay. Now, in people that suddenly collapse, they're what we call myocardiac ischemia. Okay, what we call heart attack.
Right. Lay people's terms.
Yes, heart attack. That can happen. And that usually happens when the arteries that supply the blood vessel itself, they are narrowed. Okay. So, the narrowing can sometimes cause what we call acute myocardial ischemia, such that it's like there's a sudden cut off of blood supply to the heart. And when that happens, the person can actually collapse. And usually they start with a very sudden, sharp chest pain.
Wow.
Usually on the left side. Okay. I've actually seen someone that died in the toilet. And many times, well, if you are able to get them quick enough, you start resuscitation, CPR, and all the rest. Yes, but sometimes even at that, you can still lose these people. So it depends on what is causing the heart failure. Okay, yeah, it depends on what is causing it.
Okay. Let's go to the phone lines. Good evening. Hi. What's your name and location, please? All right, Chuk, speak to us.
Thanks, Jukes. Good to hear your voice. Yeah. Hmm. Okay. See. Good. Now,
Thank you very much, Chooks.
thanks, Chicks, for the question. Yes, one of the symptoms of heart failure can also be palpitation, or what we call arrhythmia. That is, the heartbeat is not regular. Now, as you're sitting, you don't hear your heart beating. You are not conscious of your heart beating. But if someone has palpitation, you'll be feeling your heart beating. You know, you have that awareness, that consciousness that your heart is beating. That's palpitation. Now, one of the things to do is trying to look for the cause of that palpitation. The first thing is to do an ECG. So first, you go to see the doctor. You don't go to the pharmacy to buy medication. You don't go to any nurse or no. You go to the hospital to see a doctor. And then the first thing the doctor is going to do is going to talk to you, ask you some questions, examine you, and then we'll ask for what we call ECG, cardiography. Okay, so the ECG we give you the electrical tracing of the heart. Okay, just electrical tracing. So it can use it to tell what is causing, or look at what is causing that problem. Okay, that heart, that palpitation. Apart from ECG, you may also be asked to do a chest X-ray. Okay, chest X-ray in patients with heart failure, many times the heart is enlarged. Okay, and sometimes there is some water in the lung tissue itself, or even outside the lung tissue, what we call pleural effusion. That can happen. But more importantly, sometimes they will ask you to do an echogram, okay, echocardiography. Echocardiography, with that, you can see the chambers of the heart, you can see the valves, okay, you can see the structures of the heart, you can see the pericardium, the covering of that heart. And if there is fluid within that sac, you will see everything. So echo is another way to diagnose heart failure. And then more sophisticated ways, especially in patients with MI, like what I call the heart attack. There's what we call coronary angiography. Okay, there's a dye that is injected into the heart of the patient, and then it outlines all the blood vessels of the heart. So you will see the ones that are narrowed, and if you need to do anything, if you need to intervene, then you will see it. So if your wife is having that, please don't be praying at home and believing God and faith in. No, please go and see the doctor, and you'll be taken care of.
Okay, so you've spoken about some of the ways that it can be confirmed. You spoke about ECG, echo. Are there any other tests that can be used to detect heart failure?
Yes, again, you see, the purposes of test basically is the first thing about test is you want to use to confirm what you're thinking, to confirm your diagnosis. 2, you want to use to know the stage or the grade of the disease. And then 3, you want to see if it's any complication of that disease, okay? And then, of course, to prepare the patient for any treatment, especially for us surgeons, for surgery, okay? So other tests you need to do is you need to find out what is causing or predisposing this patient to that heart failure. Like, you want to know if the patient is diabetic, you need to run some blood tests, okay? Blood sugar. You need to do EU creatinine, that is to check for the renal function, the kidneys, are they functioning properly? You need to check for the lipid profile, okay, of this patient, the cholesterol and the triglyceride. You want to know, okay? These are just some of the basic tests. And then another very important one, especially for ladies, is what we call the thyroid function test.
Okay.
It's also very important, and especially in ladies, they can actually have palpitation from abnormality with the thyroid gland. Okay, so Chooks, if you're still listening, when you see the doctor, I'm sure the doctor is going to ask you to do, one of the tests he's going to ask you to do is the thyroid function test. Okay, so these are some of the blood tests you do. There are so many others, but these are the cardinal ones. Okay, you can do troponin T if you're, or troponin I if you're thinking of a myocardiac ischemia or heart attack. So these are some tests which we usually do commonly in patients with heart failure.
Okay, we have about 4 minutes. And earlier you spoke about stages of heart failure.
Yeah.
I remember you spoke about 1. Can we go through the progression?
Okay. 1 basically is you're normal, you're fine, you can do the normal things basically, but you're still predisposed to heart failure basically because so many things can happen. 2 is when you have mild exertion to activities, with with a lot of work, maybe you do moderate work and then you get tired a bit. The three is you do a little work and you're tired easily. Okay, just a little, you climb one flight of staircase and you're tired. Then the fourth one, which is the last one, is even when you are doing nothing, you are tired.
Wow.
So you are virtually like a bedridden person. So most of these patients, you have to put them on oxygen. Okay, so that's the fourth stage of heart failure.
All right, let's talk about treatment and management. When people hear that there's a heart condition, there's always a lot of fear, like, oh, this person is almost gone.
Okay.
Yeah, so can it be managed and
Yes,
can it be
yes.
treated?
It can. Now, the treatment and management is in two ramifications, medically or surgically. Okay, medically by taking medications. Okay, if you have high blood pressure, take your medications as prescribed by your cardiologist. Okay, that will take care of it. If you are diabetic, take your medications as prescribed by your endocrinologist. Same thing if you have thyroid dysfunction. Okay, so whatever medications that have been given you, take it. It will stop the progression of the disease. But sometimes you need to have surgery done, depending. For instance, a patient that has a problem with the heart valve, there is no medication is going to take that will make that go away. It can only take away the heart failure, the swelling, but the problem is still there. So you have to go and take away that problem to help to solve that problem. And the way to do that is surgery, open heart surgery. So the same thing if a patient has complete heart block, for instance, the heart is beating maybe 40 times instead of 62 times or 72 times, and the patient is dizzy and all the rest. So we'll do what we call a pacemaker implantation, okay, where we thread a wire from this outside the skin down into the heart, and then we'll bury the battery right underneath the skin. Okay. Sometimes if it's a narrowing of the vessels that supply blood to the heart, you have to do what you call coronary artery bypass grafting. So you bypass, it's a surgery, okay, a bypass surgery, and you bypass all those vessels that have been blocked, all those areas that are blocked, in order to provide blood supply to the remaining of the heart. So surgery is a way forward. Medical is a way forward. There's what we call interventional procedures. It's like a mix between medicine and it's not a serious surgery.
Okay.
So, but we'll thread it through the leg. The patient is awake, and then we'll call it stenting instead of doing a CABG. A bypass grafting. You can actually stent, put like something to keep that vessel open.
Okay.
Okay. So, but it's a problem if the patient is diabetic. So the patient still have to do surgery sometime, if the person is diabetic. So these are the different ways we can treat. So heart failure is treatable. The earlier it is caught, the better.
Okay.
The outcome. Yes.
Now, I'm certain that Evercare Hospital has, the state-of-the-art facilities when it would come to management and treatment of heart failure. If you could share really quickly, a bit more information on this with the listener.
Yes, definitely at Evercare. We have a cath lab. Right there in the cath lab, you can do coronary angio, see those vessels that are blocked. You can stent those vessels right there. And we also have a theater, state-of-the-art theater, where we do our open heart surgeries, fitted with everything you really need as a surgeon, as a cardiac surgeon. In our echo lab, we have an echo lab where we do echogram, stress echo, ECGs, and all the rest. So basically, everything for a complete cardiovascular care is available at Evercare.
Awesome. Well, thank you so much, Dr. Augustine Olugbemi, for coming through and sharing your knowledge and your expertise, which is vast. Right. So, thank you so much. How can our listeners contact you at Evercare Hospital?
You can call 081 398 50710. So once you call this number, I'm definitely going to get you Be myself.
Awesome. Thank you very much, Dr. Olubemi, for being
You're
here on
welcome.
Smooth Health on the Drive.
It's a pleasure.
And that's it for Smooth Health on the Drive. I'm Zibby. Do stay tuned. There's a lot more to come on the Smooth Drive.
Health on the Drive.
Wow. Thank you so much, Doctor.
Every Thursday,
You know,
15
wow.
a.m.
So, how many years have you been practicing for?
Transforming
I've been
healthcare
practicing
in
for
Nigeria.
about 11 years.
Wow. That's amazing.